everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And joining me this afternoon to talk about the latest developments regarding COVID-19 is a familiar face, Dr. Rashid Chotani, IEM Medical Officer. Thank you so much for being here, Doctor.
Thank you very much for having me on the show, and it is a pleasure to talk about this very critical and important subject that the nation is facing.
Doctor, I want to begin with a change, and that is regarding what the CDC considers close contact. Talk a little bit about this change and why it's important.
It's a very important subject. Previously, the CDC described close contact as someone who spent 15 minutes or more within 6 feet of someone who was infectious. And we took that as gospel, and everybody, understands and appreciates that. Now the agency has come out with different guidelines based upon some of the recent studies that they've done. And now they're saying that someone who spends a cumulative of 15 minutes or more within 6 feet of someone who is infectious over the course of 24 hours, carries the same risk as was earlier described. So that means that if you spend 3 minutes in the morning, 10 minutes in the afternoon, and the rest of it, whatever is left, 2 minutes in the evening with an individual who's infectious, and you're not 6 feet apart, you are still at a very high risk of contracting the disease. So again, definitions have changed, and it is no longer 15 minutes within 6 feet of someone to increase the risk of getting infectious. You can get infected by someone if you are with that individual within 24 hours, if you spend consecutively or non-consecutively 15 minutes.
Yeah, so what does this mean for folks? What does this mean when they're talking about or thinking about maybe getting together with others?
Well, that means, for example, if you are at an event, right, and most people would spend, 5 minutes with an individual and then move on and, talk to somebody else. But what this means is that it really doesn't matter if you are, meeting with someone for 3 minutes or 5 minutes, but cumulatively, if you are meeting that individual or interacting with that individual for 15 minutes, you are at a high risk. So wear a mask, try to make sure that, as the numbers are increasing, avoiding big social gatherings, and making sure that you're safe. Now, this applies more to people, in my mind, who are in a work environment, who are spending 8 hours in an office space, and they might be interacting with each other a lot more during the day. If somebody's a carrier, a silent carrier, that means that you potentially can get infected by that individual. So again, the best thing to do is to observe the common sense measures and keeping the 6 feet distance, making sure you're wearing a mask, and then obviously hand washing is also very important. But for this particular, in terms of the viral transmission from an individual to another, wearing a mask, keeping the 6 feet distance is the most critical thing at this particular point.
Yeah, and as you mentioned, this change coming because we are learning more and more about COVID-19. I want to talk about something that is kind of specific here to California, and that is that we have seen an outbreak in our prison system. And there was recently this court order that said, for example, at San Quentin, they need to dramatically reduce the prison population. And that means either moving those inmates to another prison or offering them early release. Talk a little bit more about how this spread is happening and what needs to be done.
So let me first say that overall, across the United States, 200,000 prison and jail inmates have been infected, and about 1,300 have died from coronavirus. In San Quentin prison, which is one of the oldest prisons in the U.S., there are about 2,200 people who got infected, and 28 have died, which makes it one of the deadliest outbreaks, prison system outbreaks in the nation. So we've got a problem. The prison has erected giant tents on the prison ground to isolate the sickened inmates. This has become a very difficult thing for them to manage. So it's not just them, by the way. Most of the prison systems have been affected, but the outbreak is the largest at San Quentin, and they have to come up with some sort of a solution, either to move these prisoners from the grounds that they are on right now to some other prison, or do some early releases. And based upon some of the information that is coming out, we believe that about 50% of the prisoners are either going to get early release, or they're going to be moved to some other, other prison. It is something that has to be done. Otherwise, more people will get infected and more deaths are going to occur in that prison system.
Yeah, I think we reported that right now there is only one active case of COVID-19 at San Quentin. But obviously the outbreak that you're talking about, it really spiked, kind of at the beginning of the pandemic. But talk about the circumstances within a jail, within a prison, that lends itself to having something like coronavirus really explode.
So, the 2,200 people and the 28 deaths, are overall since the pandemic began. But, I'm giving you a cumulative number because it's important to understand that, we're talking about more than, when you talk about 28 people and 2,200 deaths, the percent of the people that die from it is much higher than when you have 200,000 all prisoners that have been infected and 1,300 die from it, which we don't want, obviously, nobody to die. But in a prison system, what happens is that you're in close proximity to each other. And, although you have cells that are separate cells, and sometimes you have, you co-inhabitate a cell. And that obviously is a risk. And then, when you're talking about breakfast, lunch, and dinner, and interacting with other people, you're talking about a very serious risk. And the big risk is for all the guards that are in the prison system also. Now, if the guards get the disease from a prison system and then they go back home, then obviously they are taking the infection back to their communities also. So it's a circle that just doesn't end, right? It keeps on going. So rather than having these outbreaks, how can you contain it? Even if you have one positive case, you isolate that positive case and then figure out a way that you can have, based upon the space in the prison, measures that are going to make sure that people are not, people are observing social distancing and people are not just close to each other, so infection doesn't propagate. So it's a very difficult thing for them to do. And obviously there is, there are no precedents for it, right? This is the first time that, we are engaging in something like that. And obviously there are going to be a lot of lessons learned, but the prison system is now, confident that they have to do some intervention over here in order to stop the circulation of the virus.
Yeah, and as you mentioned, not only the prison system, but really all of us learning more, figuring out more, and that includes in our educational system. And we're seeing, Doctor, for example, in Boston, them really having to take a step back on what they're doing in regards to instruction for students. Let's talk about what we're seeing there.
So, from the very beginning, when the school system started in Boston, majority of the students were, doing the classes from home. They had a hybrid system. But what they did was they took the special needs children, and about 1,300 of them who had learning disabilities or were homeless to attend the class in this hybrid model. And what happened was that they, across the board in Boston, the positivity rate started increasing. It was not because of the students, but overall positivity rate started increasing. They had kind of put a threshold of about 4%. If it went above 4%, then they had to take some measures. Now, the positivity rate for the city in the last 7 days have jumped from 4.1% on October 7th to about 5.7%. So that means that the disease is spreading across, and is to make sure that whatever they can do to contain the virus, they'll have to take those measures. And one of the measures is to make sure that they have no in-person schooling, which is going to be a very difficult thing, especially when you think about disabled children who have disabilities, kids who are homeless, and there are a lot of people, a lot of kids that are homeless, not only in Boston school system, but across the nation. And that is going to be a very tough, at least for me, that's a very tough thing to, swallow.
Yeah, no, it is. I mean, it's a struggle. We've seen study after study showing that, teens in particular are having a really difficult time coping with all of this. Let's look, though, big picture, coronavirus nationally. How are things looking, and what do you expect as we head into the end of the year?
Well, we have over close to 8.4 million cases and over close to 225,000 deaths across the nation. It's a pretty grim number. Since September 12th, the country's 7-day average for daily cases has surged by more than 70% from 34,000 to 59,000 approximately. And that is a huge number. We are seeing in the Midwest and the West record number of hospitalizations, and that has just put workers and the healthcare workers at the brink of exhaustion. These numbers can be controlled, obviously, but what has happened is that we are tired, we are exhausted. There is coronavirus or COVID-19 fatigue, as I call it. We have peer pressures. And then on top of that, the cold weather is putting everybody inside. So the virus also loves this time of the year, and it's seasonal transmission. And those are the reasons that this virus is just spreading very, very quickly in a lot of different states. Just last week, there was an increase in about 42 states in terms of hospitalization. And, and for example, New York rose to about, hospitalizations in New York rose about 53%, and Texas 32% in the past 3 weeks. These surges are huge. And, we always talked about, everybody, all the experts have agreed and talked about that the numbers are going to go up. And these numbers are really going up and going up very fast and very rapidly. So we've got to be very cautious. We can't let our guard down at all.
Yeah. Well, thank you for letting us know the status of things nationally and providing that important message to viewers. We're going to leave the conversation there today. Dr. Rashid Chotani, infectious disease expert and medical officer at IEM. Appreciate it.
Thank you so much, and look forward to seeing you again.